All right, well, it's 8 a.m. Welcome, everybody. Hope everybody is enjoying this lovely fall morning. And we're delighted to have a panel or dueling presenters today. And to introduce our presenters, I have Dr. Blair Golden from the Division of Hospital Medicine.
Hi,
Dr.
everyone. Good morning. I'm super excited to introduce these two speakers. I think we have a really exciting talk ahead. So first, we have Dr. Rohan Bodapati, who's a clinical assistant professor in our Division of Hospital Medicine. He graduated from the Community Institute of Medical Science in India and completed his internal medicine residency training in St. Joseph Hospital in Chicago, where he also served as a chief resident. He currently serves as the co-chair for the International Medical Graduate Committee in ACP, Wisconsin, and has a very deep interest in physician well-being. He is an advanced yoga practitioner with many years of experience, and you'll be hearing about some of that today. His prior research work involved heart rate variability studies looking at cardiovascular outcomes, and he is currently exploring human consciousness research and hoping to blend science and spirituality for human well-being. He will be joined today by Vasu Prudhivi, who is an Aisha Foundation certified classical hatha yoga instructor. She has over 2,000 hours of training and more than 4 years of teaching experience across very diverse communities. Having personally experienced the transformative benefits of yoga on physical, mental, and emotional health, she has a passion for improving health outcomes for all. She also has 13 years of very diverse professional experience, including consulting, professional development coaching, and human resources. So with that, I'll turn it over to our speakers. Thank you.
Thank you so much. Good morning, everyone. Thanks for joining us this morning. I hope you guys can hear me okay. And thank you so much, Blair, for that wonderful introduction. I'm Rohan Bodapati. So my goal for this talk today is to teach you all a yoga-based practice called Isha Kriya that you can use for improving your well-being. The first few minutes, I will talk about my own experience of how I came across this practice and then share some evidence behind the practice. My co-speaker will introduce the practice and take you through a guided session, hopefully leaving some time at the end for any questions. We have no conflict of interest. So the moment someone says yoga, the first thing that comes to most people's mind is twisting your body into a human pretzel. I want to tell you that is a myth. Yoga is a spiritual science that gives us methods to achieve physical, mental, emotional, and spiritual well-being. So our learning objectives for today would be to discuss the individual experience of stress, anxiety, depression, and burnout, describe some scientific evidence behind some of the yogic or meditative practices, and utilize Isha Kriya for the personal well-being of all of us. So my journey began with my uncle, who was a colorectal surgeon at Mercy Hospital in Chicago. He was an advanced yoga practitioner himself and one of the kindest human beings I have ever met. He was my inspiration to become a physician and pursue a career in the United States. He was always exuberant and very joyful. Everything seemed to function very smoothly around him, like a well-oiled machine. For any kind of difficult situation he was in, he seemed to have a solution that would benefit everyone involved. But in 2004, he was diagnosed with metastatic colon cancer with a prognosis that gave him less than a year. We as family members were devastated, but it never wiped that smile off his face. He underwent chemotherapy, he continued to teach, he treated his patients for some time, but with only a few months left, he intensified his spiritual practices and he became a monk of the Bharati order. Despite severe cancer pain, I never once saw him complain, and he was never on any painkillers. When I asked him how this was even possible, he said, "Pain is of the body, suffering is of the mind. I have gathered both body and mind, but I am neither." This was the first time I heard anything like this. He told me that this has been known to the Eastern traditions for many centuries, and he gained firsthand experience through his yoga practices. When asked to explain how this works, he said that yoga means to be in perfect tune. He explained that there's layers of human existence according to yoga. He said that yoga is a way to reach your ultimate potential by employing 4 faculties. That's your body, mind, emotions, and energy. When you use your body to reach the ultimate, it's called karma yoga. When you use your mind, it's called jnana yoga. When you use your emotions to reach the ultimate, it's called bhakti yoga. And when you utilize your very life energies to understand the mechanics of life and reach the ultimate, it's called Kriya Yoga. This was very hard for me to understand as a high school student. So he gave me an example of a car with its wheels. For you to drive your car in one direction, all four wheels need to be aligned. And so yoga helps you align them. Obviously, I was excited. I asked him how I can experience this myself and he said, watch your breath. Bring together your body, breath, and awareness. He basically asked me to pick any point on my body and notice the sensations that occur with each inhalation and exhalation, maintaining my awareness on that point. My mind wandered, and it was very hard to keep my focus. I tried to keep bringing back my attention to that point I chose, but I could barely maintain any consistent awareness. I tried doing this practice for about 5 minutes every day, but I couldn't really get anywhere. I ended up giving up the practice after my uncle passed away in 2005. So I started med school a year after he had passed away. I knew I wanted to come to the US for residency training. After I graduated med school, I was working full-time, preparing for my application for residency. During that time, my dad suffered several strokes, which required me to halt my plans of residency and stay back in India to support my family. It was a pretty stressful time for me as I could not do what I wanted to. So I kept ruminating on the time that I was losing, and I was getting farther away from my med school graduation, and several of my classmates were already in residency or almost about to finish. I was so lost in thought that it started affecting how I behaved with my family and friends. I became lonely, distracted, frustrated, anxious, and stressed. How many of you ruminated on thoughts in the past day or in the past week? They could be thoughts about a medical error that you made, some labs that you ordered that came back abnormal at night, and you couldn't act on it till the next day, so you're losing sleep on it. Or you've had conversations with your patients or their families that you thought could have gone differently. I'm pretty sure most of us would raise our hand for that. Thought rumination is very common, especially in physicians. So what is rumination? Rumination essentially involves repetitive thinking or dwelling on negative feelings and distress and their causes and consequences. This repetitive and negative aspect of rumination can contribute to the development of depression and anxiety. There's several factors that are associated with thought rumination. One of those could be stressful events such as a failed relationship, losing a job, death of a loved one, or some kind of a traumatic event. Or you could be a perfectionist with a tendency to set unrealistic goals and worry about failure. You could have low self-esteem. You could have some sort of a fear, or it could just be structural with your brain biology, and you're just built in a way in your brain structure that you ruminate more than others. You could have anxiety sensitivity. Now, it's a lot of physicians are actually anxiety sensitive when it comes to issues related to the patient care. Again, some of these are actually not necessarily bad qualities, but these are qualities actually that make physicians better, but it is the dwelling on them that causes the problems. So just for a basic understanding, I wanted to touch upon this triple network model that was identified based on functional MRI studies that identified these three canonical brain networks. The one that on the top that you're seeing is called the salience network, the one in yellow. The one on the left bottom in red is the default mode network, and the one in blue is the frontoparietal network. Now, thought rumination is said to occur because of hyperactivity of the default mode network. What does the default mode network do? It essentially helps develop an internal narrative of your experiences. It's essential for us to do our daily activities based on our memory and experience. It is the basis of our self-referential thought process. And then the frontoparietal network helps with goal-directed behavior and attention and screening out responses. It essentially controls the higher cognitive functions. Decreased connectivity between the frontoparietal network and the rest of the brain has been linked to increased depression symptoms. And the salience network controls the dynamic switching between the default mode and the frontoparietal network. A strong salience network allows for faster switching between the modes, allowing for better voluntary control of responses to external stimuli. So why is all this important to know? Essentially, you want to be able to switch away from the default mode network, the red, to reduce this thought rumination that leads to stress, anxiety, and burnout. And the way to do it is to strengthen your salience network. And there's evidence that you can do this consciously. There have been several studies on mindfulness-based and yoga-based practices, including several meta-analyses. This was one such article that was published in Nature Scientific Reports in 2022 that found that mindfulness-based practices make the salience network stronger and improve connections between various neural networks. I want to bring your attention to this study that was conducted by Dr. Richard Davidson's group. Dr. Davidson is a psychology professor with us here at UW, and he's the director of the Center for Healthy Minds. Their group conducted a study in 2012 that compared long-term meditators with non-meditators to evaluate the recovery from negative events. They used functional imaging to identify activation of various brain regions that correspond to pain. I'm going to use the pointer here and show you what essentially did. So when you look at the image here, what you're seeing is in the green is the non-meditators, and in the gray is the long-term meditators with a lot of experience. What they did in this experiment was they used heat as the pain stimulus, and 10 seconds before they gave the pain stimulus, they played a tone to build the anticipation that in the next 10 seconds, there's going to be a pain stimulus that comes in. So when they looked at the non-meditators, as soon as the tone was played, they immediately activated their pain response. And they continued to respond when they got the pain stimulus and had a slow recovery. On the other hand, the long-term meditators, when the tone was played, nothing happened. And when the actual pain stimulus came, they had a robust response, even more than the non-meditators. But as you can see, they had a very quick recovery and return to baseline. This can be seen as the neural signature of resilience. So I started residency in 2018. I got very busy with the steep learning curve because of the transition to a new healthcare system, but I managed reasonably well with some forms of yoga that I had learned by then. As residency progressed, I got busier and had less and less time for yoga, but the ultimate stress test happened when the COVID-19 pandemic hit. I was a frontliner, like most of you, as a senior resident working in the ICU. My wife had just delivered our child. My elderly parents and in-laws who have multiple comorbid conditions were with us at home. I was seeing COVID patients die almost daily. Like many of you, I was holding my dying patient's hand while their families could only see them through the glass doors. I was scared to go home, fearing similar fate for my family. This was the peak stress that I ever felt in my life, to a point of significant burnout. I knew by this time that yoga or mindfulness-based practices help, but I perceived a lack of time to do the practices that I had learned by then. I looked for a practice that took much less time, could be done anytime, anywhere, and is effective in regulating my emotions so I could continue to function at my best. My search led me to Sadhguru. This is a quote from Sadhguru, the founder of Isha Foundation, that says your body and mind are just accumulations that you have gathered. What you accumulate can be yours, but it can never be you. This sounded extremely similar to what my uncle told me many, many years ago. Sadhguru says that our body is the food we consume, and our mind is essentially a gathering of impressions from the outside. Yoga helps us identify who we truly are and gives us the ability to see our body and mind as mere tools at our disposal. All the suffering in the world is either physical or mental. And once there's a separation of what is you and your mind and what is you and your body, that is essentially the end of suffering. This was very powerful and had a deep impact on me. When looking through what was being offered by Sadhguru, I found Isha Kriya, a very powerful practice that is the basis of many other advanced practices that uses the concept of body and mind that I just talked about. So Isha Kriya is a very easy practice that can be done at any time of the day and help you center yourself and focus on the task at hand. It's a 12 to 18-minute practice. There have been several studies conducted on Isha Kriya and some other advanced practices from the same school. I want to share a few of them here. I've taken the following 2 to 3 slides from Dr. Balachandra Subramaniam's presentation at the G20 summit that happened about a year ago. He's an anesthesiology professor at Beth Israel Deaconess Medical Center, a Harvard Teaching Hospital, who has significant contributions in consciousness research. The idea of providing this Isha Kriya as a tool in this Grand Rounds talk actually came from my meeting with him in April this year. So the first study that I want to share here is based on a Grandon's talk at Harvard. It is well known that surgeons and other operating room professionals often face exceptional demands at work from the care of critically ill patients. These demands often trigger high stress levels and burnout. Very few actually receive training in managing the stress, yet coping skills for healthcare workers are crucial to prevent stress, increase happiness, reduce the likelihood of human error, and most importantly, improve patient safety. As a first step towards addressing this study assessed the stress levels among anesthesiologists, nurses, and surgeons. It further evaluates the effectiveness of meditation in reducing stress. The more than 300 anesthesiologists, surgeons, and residents, attending physicians, and nurses participated in this survey that measured the stress. This survey clearly illustrated that majority experienced at least moderate levels of stress. Within the same group, total mood disturbances were found to be significantly reduced after practicing Isha Kriya guided meditation just once. Negative disturbances such as tension, anger, fatigue, confusion, and depression were significantly reduced after this meditation, with anger being the most significantly reduced. Similar results were also observed in a group of 44 anesthesiologists that attended the American Society of Anesthesiology conference, where Isha Kriya was offered. This suggests that Isha Kriya might improve mood regulation and the ability to deal with stress and burnout, which may in turn improve workplace well-being, patient safety, and quality of care. They concluded that the practice of Isha Kriya guided meditation as part of a daily routine to improve well-being among operating room professionals needs to be considered. This observational study assesses the effectiveness of online meditation training of self-reported symptoms of anxiety and depression. Isha Kriya was essentially offered online to the public. After 2 weeks of Isha Kriya practice, those with baseline anxiety and depression showed significant improvement with a large effect size and going from severe to mild anxiety on the scale. The results from weeks 4 and 6 showed sustained reduced anxiety and depression symptoms. Basically, these findings suggest that Isha Kriya practice could alleviate symptoms of anxiety and depression, even when offered in an online format. It also implies that this is easily scalable. Future studies utilizing randomized control trials are needed to rigorously evaluate the benefits of this meditation practice on anxiety and depression. I want to point to this study, which is of a more advanced practice called Bhavaspandana, with Isha Kriya being its basis. In this study, they measured serum levels of brain-derived neurotrophic factor, or BDNF. A low BDNF level has been strongly associated with severe depression. They noticed that the BDNF levels significantly increased with this advanced practice. They also measured endocannabinoid levels. So there's something called AEA, or anandamide, and 2-arachidonyl glycerol, 2-AG, that have been associated with enhanced mood and feelings of blissfulness. The term anandamide itself is derived from the root word ananda from Sanskrit, which means bliss, for its cannabimimetic effects. Serum levels of both anandamide and 2-AG may be reduced in patients with depression and anxiety, and the endocannabinoid system plays a fundamental role in emotional homeostasis. So they measured the anandamide levels and found that with this practice, there was significant increase in the levels, but particularly the 4th quartile participants were able to increase the anandamide levels by even 2 to 3-fold. Essentially, they were able to achieve the effects of cannabis without ever touching an external substance. Those of you familiar with trauma work, Dr. Gabor Mate is a renowned physician with pioneering work in childhood trauma and ADHD. I want to play this short clip from his interview where he talks about Isha Kriya.
I've always said that with my ADHD, I'm not a yoga person. I can't do it. Until a year and a half ago, I met actually a yogi. His name is Sadhguru, and he's an Indian yogi with a big following. I was very skeptical, but I met the guy. I now have a 50-minute daily yoga practice, which I did this morning before coming to the interview, and it's made an enormous difference in my life. With my ADHD mind, I really have trouble just sitting there. When I sit on the meditation cushion, my mind is like all over the place. But with the yoga, which is more body-based, I can stay much more present. There is a meditational component to it. And so the answer is yes. If you had asked me 18 months ago, I would have said no, I support it, but I don't do it. But now I'm actually a very committed practitioner, and it really has made a difference.
So there's certainly evidence indicating that Isha Kriya is an effective practice to help with stress, anxiety, depression, and burnout. I personally have found great benefit from this practice and now actually do regular practice of several more advanced practices such as Shunya meditation and Samyama, the fundamental basis for which is Isha Kriya. These advanced practices give you a deeper experience of the truth shared in Isha Kriya. Therefore, we are offering this practice for you to utilize for your personal well-being. I will now hand over to Vasu, who will introduce the practice and take you through the guided session.
Thank you, Rohan. So I'll start by sharing a few slides. All right, hopefully everyone can see you. So I'm very excited to be here. I did want to start by briefly talking about our center. So I work with the Sadhguru Center for a Conscious Planet. We're located at the Beth Israel Deaconess Medical Center. This is essentially a Harvard teaching hospital. Our work is really at the nexus of research, education, and outreach. So we're offering a variety of wellness programs. We're conducting scientific studies on them, some of which Rohan shared. And we're also conducting outreach to different communities to share about the amazing work that we do. Now, I'm very excited to be taking you through this Isha Kriya meditation. So this is a 15-minute meditation that's available online. It's fully guided, so all the instructions are there. The beautiful part about this practice is that it can literally be done anytime, any place. So even at your workplace, in the middle of a very stressful day, you can just take the time to sit and do this practice. It requires no prior experience of yoga or meditation at all. This has also been made available in multiple world languages. So in case you're eager to share this with someone that you know who doesn't speak English, that is also available and also online and absolutely free of cost. And the best part, I feel, is that it doesn't need an instructor to do it on an ongoing basis. You just go through the meditation, follow along with the instructions. And it's absolutely safe for anyone to do, regardless of physical abilities, mental abilities. It's absolutely safe for anyone to do. I did want to touch again a little bit about the research. So Rohan was able to walk through some of this. So we've done about at least 8 different studies on this practice over the last 7 years. And consistently across these studies, we've seen that mood quality is significantly improving through this practice. We've even seen a drop in perceived stress levels within just one practice session. So just sitting down and doing the practice once is showing to reduce perceived stress. We've observed brain scans across people who are doing this practice consistently over a period of time versus those who are just getting into it. And we're seeing that in those who are able to do this on a daily basis over a sustained period of time, we're seeing activation in their brains, in the functions, in the areas that are related to focus, relaxation, problem solving, cognition, memory as well. So there's a lot of benefits really in just doing this very simple practice. There's a couple of additional studies we've done in collaboration with other universities as well. Again, Rohan walked through this a little bit. So we're seeing an improvement in mental health symptoms in just 2 weeks of this, of doing 2 weeks of doing this on a regular basis. So drops in anxiety levels and drops in depression levels as well. So in summary, this Isha Kriya meditation, this positively improves mood. It reduces stress within just a single practice of this meditation. Sustained practice is able to lead to positive impact in their mental states. And you can also see a reduction in anxiety and depression within just 2 weeks of sustained practice. Now, I always like to say more powerful than any research is the actual experiences of people doing this on a regular basis. So we heard one sharing from a YouTube short, a couple of additional sharings from folks around the world. So Mary shared that she was able to observe transformative changes to her life. We have Amy from Netherlands who shared that she was able to experience profound moments of bliss and connection. and from Cyprus, sharing she felt more calm, more at peace in her daily life. I myself have also experienced this meditation and the impact. I used to be a huge skeptic. I come from a consulting background, so very logically wired brain. I didn't think any of this yoga meditation stuff worked, but I was at a time where I was experiencing a lot of stress in my life, and I needed something. And I heard a lot of great things about this meditation. I was like, there's no harm in trying this. Why not give it a shot? So I did this every day for a few minutes at the end of a very, stressful days. And within a few days, I started to notice something was shifting very deep within me. And that led me to want to explore this deeper. And, it started my whole yoga meditation journey. And I went for the whole teacher training as well. I've also had the privilege of being able to teach this to patients here at our center. And these are patients who are going through a lot of serious medical conditions. And what often happens with patients is we focus so much on the medical side of their treatment, but we often neglect, the mental burden that they experience and just having to deal with so many symptoms, so many checkups. And we offer this meditation to them. And some of the sharings that they have are just very touching for that, just to experience a little bit of that calmness and be able to deal with whatever they're going through in their medical journeys. More than what they say verbally to me, it's like just seeing them in a session, regardless of whether I'm teaching it to them online or in person, as they go through this meditation. By the end, it's just like this wave of, calmness has just passed over them. So it's really amazing to see that. So we thought, we've spoken a lot about it, so hopefully you're ready to go through this. So we'll go through this meditation. I'll be playing a video, so you'll go through it using the full support of the video. A couple of things just to keep in mind before we jump into it. Assuming everyone is sitting on a chair for this session, I want to make sure that you're feeling very relaxed and comfortable in your chair. You can use the back of your chair as a support for your back. And then just make sure your head is not leaning on anything. So you want to keep your head loose, but you can use your chair as a support for your back. Your hands, you want to keep them palms facing upwards and just keep them loosely on your thighs. So make sure your upper body is very loose and relaxed. And your legs, you can keep your legs crossed at the ankle. So just keep your right ankle over the left ankle. Again, hands facing upwards, loosely on your thigh. If you need any extra cushions or anything just to get yourself very comfortable, you can get those. So we'll go through the meditation. Some of you may be familiar with meditations. I did want to say this is very different to anything you might have experienced, so keep a very open mind as you're going through it. They'll give the instructions initially, so you can observe what the instructions are, and then you'll be guided into the practice. So the meditation itself will be happening by Sadhguru, so he'll guide us through the full process. Like Rohan mentioned, he's the founder of Isha Foundation and a world-renowned yogi and mystic. All right, so I'll stop sharing the slides and just give me a moment and I'll pull up the video for this. All right, hoping everyone enjoyed that experience. I'll hand it back to Blair or Rohan.
Well, great. Thank you so much. I see we have probably some questions coming in through the chat. If not, feel free to ask them. One question I wanted to ask you guys is, so I do a lot of delirium research, and in the delirium world, there is a lot of interest in kind of cognitive prehabilitation activities to build cognitive resilience. So things like tablet exercises, things that kind of activate neuronal pathways as a way kind of to hopefully reduce rates in anticipation of kind of surgery and otherwise. And so I know that there's been some interest maybe in kind of thinking about yoga or other activities, but wanted to see if you could kind of speak to any of those applications of kind of meditation in terms of like anticipated stressors, whether it's a surgery or a hospital stay.
Yeah, I can speak to that a little bit. There have been some studies that looked at some of these activities that they do, especially for delirium studies as well. And these are activities that they were given, again, not to really demented people, but with mild cognitive impairment and things like that. And I can certainly share that research later on. But they found that these activities are improved with some of these yoga practices, including Isha Kriya. Actually, there's, I think, one of the studies is looking at Isha Kriya, or inner engineering rather, Shambhavi Mahamudra Kriya, which is kind of the next step that you would take. That has shown a lot of benefit, and so that's sort of the direction that I'm taking now going forward, where I want to look at the applications of these methods that have been there for many centuries, but we're only getting to get more scientific evidence to support it with the current technologies.
Great, thank you. One of the questions we had in the chat, which was from kind of our colleague Farah Cakeso, was about asking about any hospitals that have or incorporating medicine into inpatient care. And also if you have any suggestions on where patients kind of, or this sort of program kind of might start as an early step.
Yeah, so I can give, yeah. So in terms for patients who are curious to know, so this link, this meditation, all of you can actually share directly with any of your patients. It's available online. You just have to go to YouTube and look for Isha Kriya. So that is definitely a good first step. Our center, we have wellness programs for patients, which we run on a one-on-one basis. We do have a preference for in-person, but of course, location would be an issue for patients you might be working with. So we are also open to online. And so that could be a potential, like an option as well. So if anyone's interested in, like, it would be more one-on-one care. And we basically, what we do in those programs are, depending on their conditions or medical conditions, we curate very specific yoga practices. So it would be yoga and meditation practices, and we teach them. So it could be in that online setting or in-person setting. So you could either get in touch with, I'm happy to, share more information to anyone who might be interested, either in the form of a flyer or a couple of bullets and an email. So
I'm going to just follow up on that from a practical standpoint. So how do you get referrals from physicians, or is it nurses who like puts in a consult? Mechanistically, how does it work?
yeah, absolutely. So within our hospital system here at BIDMC, it is through referral. So that is for patients who are already receiving care, but we do open it up to, people who may not be receiving care. So we do direct consultations as well. So either way works. We do prefer to work through physicians who can refer and speak a little bit about it, but direct consultations are also an option. So we just have that sign up link, so we can share that link with the group over here, and have patients can sign up through that.
So as a physician, if I'm taking care of a patient, I would just say, I'm going to consult ID and I'm going to consult you.
Exactly. Yep.
And we'll see who gets there first. Great. So I have a more of a practical question. First of all, thank you. It was a really interesting presentation. What I really liked is blending the bringing that scientific rigor and evidence to the practices, which is often lacking in many of the presentations. So I thought that was really powerful. So thank you for doing that. From a practical standpoint, as a type A personality, I'm listening to this and I'm hearing, okay, you're doing this for 7 minutes and then you're doing your Oz for, X amount of time. How do I track time as I'm supposed to be focusing on this? That's what I think about. I'm like, is it time yet? Am I there? How much longer? Do you have an alarm when you first start? Like how do you manage that?
How do you work? I'm right there with you. When I started, I was like, there's too many things to do. I can't keep track of like, is the time up yet? I need to get up and go. So the beautiful part about this is it's guided. So we don't need to keep track of it. So just go to YouTube, start it, play, and just follow along.
But presumably, there will be places and times where you're hopefully won't have access to YouTube or internet. So how do you manage that on your own? Like do you use an internal clock? Do you set your...
Yeah. So what happens is after a period of time, once you get used to the practice, there's an internal clock that starts to develop. So you kind of know when it is up. Although for us, like initially, we always recommend using the support of the video, because that does take time to develop. And you could even download this onto your phone, and there's a lot of apps out there which just pull it onto your phone, keep it there. To take it a step further, there's actually an app that Isha Foundation has designed. So it's called the Sadhguru app. That's not associated with our center in any way, but that is another option. Like it's there on that app as well. So you don't need that internet connection as well. You just go there. The meditation is available on that as well. So accessible offline also.
I would just to add a little thing to that, it's sort of like how when it's like 5 or 10 minutes with your patient, right? Like when you walk in and you're talking, you have that sort of in the back of your mind when you're rounding that, oh, this is probably about this amount of time. And you're often right. That just comes with practice. So the more you practice, the more you know that 7 minutes and the 5 minutes added to that. So I think it just needs a little bit more practice, just like everything else.
Yeah. And then along the same lines of being incorporated into patient care, are there any medical schools that are incorporating this into their curriculum for student teaching?
That is a great question. I'm not sure about medical schools, but I know that some universities are trying to get this as part of the curriculum. We have one teacher who's actually at Rutgers who is trying to integrate yoga practices into a course. So I know she's definitely doing that. I know, Rohan, if you're aware of anyone else.
I've been in conversations with Dr. Subramaniam, who's the director of the Sadhguru Center for Conscious Planet, and I was just chatting with him last night as well about starting something like that at UW for our medical students and residents. And we've had this conversation last year as well about bringing like a structured program that would give more tools for our residents, especially in the first year of residency. That's kind of when the high stress levels are, and when you're trying to adjust to a new level of functioning. And so we're trying to figure out a structure for it, and hopefully we'll bring that to all of you soon.
Great. And then Farah mentioned in the questions that University of Cincinnati apparently offers this to medical students as an option.
Yes, I think that is true.
And then there's a question from Dr. Vasilevsky's. It seems that pain clinics would be a natural fit for this type of practice. Is this happening at places? And
so
interesting. And as a follow-up, I think this is an interesting question. Can you demonstrate decreased need for pain medication with incorporation of these practices?
That is interesting because our center is actually located in the pain department at BIDMC. So we are very well integrated into the pain center. So a lot of the referrals that we have for those one-on-one programs I was mentioning are pain patients. And that is what they share. It is very supportive and helpful. I may not be able to comment directly on the reduction on the dependency of pain medication. So whenever we teach, we always, caveat that this is not designed to replace medical treatment, but rather as an additional support to better manage your symptoms. So from that perspective, definitely people have shared that it's helpful.
One of the things that I'm actually looking into is to see if we can, give this practice to our patients that are opioid dependent and are in the hospitals, and see if their usage actually comes down. And that's something that I want to look at among several other things. And so that's probably coming too. That's in the future.
Great. I think we are just at time. So thank you so much. Yeah, I think another sentiment in the question and answer is many of us, I will confess, I would be one of the people, would not have gone voluntarily and sought this on my own. So giving us the opportunity to share in this was really powerful. So appreciate bringing this to us, a really interesting grand round session, wonderfully presented. And thank you all. And